The translation of teratogen is monster generator. So a teratogen is anything that can influence or cause developmental defects in the developing embryo. Because the placenta, as we've talked about, is not an absolute barrier, some things can cross. So anything that would be considered dangerous to give to a newborn infant should be considered dangerous to give to the mother, because the placenta does allow so many things to cross. Alcohol is the #1 fetal teratogen, and exposure to even a small amount of alcohol can cause fetal alcohol syndrome, which is one of the most common causes of mental retardation and also the most common preventable cause of birth defects in the United States. Some of the symptoms of fetal alcohol syndrome include slow growth both before and after birth, very characteristic facial features, which include a thin upper lip and the bridge of the nose appears somewhat depressed or sunken, defective heart and other organs, malformed limbs, genitalia abnormalities, and central nervous system damage. They're usually accompanied by behavior problems as well, such as hyperactivity or extreme nervousness, reduced ability to concentrate, and an inability to appreciate cause and effect relationships. So all of these are very commonly seen in those children suffering from FAS. Other teratogens include certain viruses, such as hepatitis B and C and papillomavirus that are all transmitted sexually, pesticides, defoliants, which are chemicals that cause plants to lose their leaves, industrial chemicals, some hormones, antibiotics, anticoagulants, anticonvulsants, anti-tumor medications, thyroid drugs, numerous prescription drugs, LSD, cocaine, and thalidomide. Thalidomide was a very famous drug that was given back in the late 60s and early 70s to mothers that were pregnant and suffering from morning sickness, because it had the effect of preventing or calming some of that morning sickness. However, a lot of the mothers that took the thalidomide during that period gave birth to babies that had birth defects with the limbs, and they were sometimes commonly called flipper limbs because they were very, very short limbs with the hands and the feet attached. Of course, then it was realized what these mothers had in common was that they took thalidomide, and that drug was no longer prescribed for morning sickness. A pregnant woman who uses cocaine is going to subject that fetus to higher risk of slowed growth, attention and orientation problems, hyperirritability, and also a tendency to stop breathing, missing or malformed organs, strokes, and seizures. These types of teratogens also increase the risk of spontaneous abortion, what we commonly call a miscarriage, or the risk of giving birth prematurely, or stillbirth, giving birth to a deceased child, increase with the exposure to cocaine. There is also strong evidence that shows that cigarette smoking during pregnancy causes low infant birth weight. There's also a strong association between smoking and higher fetal and infant mortality rates. Women who smoke have a much higher risk of developing an ectopic pregnancy. Cigarette smoke may be a teratogen and may cause cardiac abnormalities as well. Mothers that smoke have an increased factor in their babies developing cleft palate and cleft lip, and it has been also linked with sudden infant death syndrome. Infants nursing from cigarette smoking mothers have also been found to have an increased incidence of gastrointestinal disturbances. Even mothers' exposure to secondhand smoke, and of course that's just breathing smoke where someone else is smoking, during pregnancy or while nursing can also predispose that baby to increase incidence of respiratory problems, because if it gets into mom's system, it gets into mom's blood, it gets into the milk mom is developing, and then of course the baby is getting that as they nurse as well. So this leads to respiratory problems such as bronchitis and pneumonia that are increased during that first year of life to moms that smoke or are either exposed to secondhand smoke. Ionizing radiation is another type of very potent teratogen. So exposure of pregnant mothers to X-rays or radioactive isotopes that are sometimes used in tracing studies. For instance, if you get a nuclear gallbladder scan, those radioactive isotopes are also known to be teratogens. So whatever that particular period of development with the embryo is at that time, then that particular part of the body is subject to being malformed. So for instance, if the mother is exposed to X-rays or the radioactive isotopes when the head is developing, then it may actually cause the head to be very small in relation to the rest of the body, and that's a condition that's called microencephaly. Can also lead to mental retardation and other skeletal malformations. So anytime that a mother needs to have an X-ray or these types of studies, caution is very, very much advised, especially during the first trimester of development when, of course, the organ systems and the limbs are forming. All right, so let's talk just a little bit about some of the tests that are available to detect genetic disorders and also used to assess fetal well-being. So if there's any question about whether or not a pregnancy is progressing normally, a fetal ultrasound may be performed. I don't know why suddenly I can't talk. So if there is any question that perhaps something is going wrong with the pregnancy, an ultrasound is done. This is a very, very common use of diagnostic ultrasound technology just to make sure that there is an accurate fetal age, because as we know, we don't always remember exactly when our last menstrual period was, and sometimes you may have a little bit of spotting and you may think that was your last period and perhaps you had already been pregnant for a bit. So it's used very commonly just to confirm that there is a pregnancy, to evaluate the viability of the fetus and if the fetus is growing properly, to determine the position of the fetus, and to identify if perhaps there are multiple pregnancies or if there are any type of abnormalities that can be detected with the ultrasound, because technology has developed to a point where we get very good images using ultrasound. It can also be used to aid in features or in procedures such as amniocentesis that we'll look at in just a moment. So during fetal ultrasounds, a transducer, which is just an instrument that emits high-frequency sound waves, is moved back and forth over the abdomen, and then the reflected sound waves from the developing fetus are picked up by the transducer and converted into an image on screen that we call a sonogram. Because the urinary bladder serves as a landmark for finding the fetus and, of course, the uterus, the patient usually is going to be told to drink lots of water or lots of liquids before the procedure and not to urinate so that you can keep a full bladder. All right, so let's talk just a little bit about amniocentesis. So this is a process that involves withdrawing some of the amniotic fluid that surrounds the fetus during development, and then examining that fluid, which is going to contain some of the fetal cells and also other dissolved substances from the fetus. So it's used to test for the presence of certain genetic disorders such as Down syndrome or hemophilia, sickle cell disease, and certain muscular dystrophies. It's also used sometimes to determine the viability of the fetus. So the test is usually done somewhere between 14 and 18 weeks of gestation. And during that time, most of the chromosomal abnormalities can be detected through amniocentesis. This information can be very important for the diagnosis of sex-linked disorders where the fetus may be carrying an abnormal gene. During amniocentesis, the position of the fetus and the placenta needs to be identified first by using ultrasound and palpation. So feel around and then get a good view with the ultrasound. The skin is prepared with an antiseptic, and then a local anesthetic is given because a somewhat large hypodermic needle is going to be inserted through the mother's abdomen and into the amniotic cavity within the uterus. And then you withdraw about 10 to 30 milliliters of fluid, and of course the cells that are suspended in that. microscopic examination is done and biochemical testing is done to look for any abnormalities. So amniocentesis is usually only performed when there's a risk of something being wrong, if there's a risk of genetic defects perhaps suspected, because there's about a 0.5% chance that amniocentesis can trigger a spontaneous or miscarriage after the procedure has been completed. All right, next we'll look at chorionic villi sampling, where a catheter is going to be guided in through the vaginal canal and the cervix of the uterus and then is pushed to the chorionic villi. So you use an ultrasound to guide this passageway. You take about 30 milligrams of tissue, suction it out, and then it's prepared so that a chromosomal analysis can be done. Chorionic villi can also be sampled by inserting a needle through the abdominal cavity, very much like is done with amniocentesis. Chorionic villi sampling can identify the same types of defects that you're looking for with amniocentesis because chorionic cells and fetal cells contain the same genome. The chorionic villi sampling offers several advantages over amniocentesis, though. It can be performed much earlier, so as early as 8 weeks of development, and the test results are available in only a few days, which can prevent much earlier decisions should there be something wrong with that developing fetus, and the parents need to decide whether or not to continue the pregnancy. The chorionic villi sampling is slightly riskier, though, than amniocentesis, where there's about a 1 to 2% chance of spontaneous abortion after the procedure.